afternoon. Good afternoon. How is everybody doing this afternoon? Welcome to my channel. My name is Sylvia Kathy. Yes. So today we are going to have another interesting topic. We're going to talk about contraceptives. Okay. So before we continue with our topic, please like and share. Very, very important. Like and share. And always mask up. If you have to go outside, please mask up, social distance at least 1 to 2 meters apart. Always sanitize or wash your hands. So they want everybody alive. Let's stay alive. COVID is real. Okay, so back to our topic. Yes, so back to our topic. I said we are going to talk about contraceptives today. You can also call them birth control methods or family planning. Okay, so what are contraceptives? So before we continue, you have to understand what contraceptives are. Then we are going to look at the different types of contraceptives, and then we're going to break it down to explain those types and methods and explain their benefits. Okay, so contraceptives, they refer to methods used to prevent pregnancies. Okay, so there are methods of preventing pregnancies. So examples are condoms, pills, injections, and so on. So we're going to look at those in details. Yes, so there are three types of contraceptives. So we have the non-scientific methods, we have the traditional methods, and we have the modern scientific methods. So the non-scientific methods, these include use of charms, use of rings, amulets, incantations, traditional medicines. So these methods are rarely used these days. These are the types of methods that our grandparents or parents used to use a long time ago to prevent unwanted pregnancies. Yes, so they are rarely used today in this century, but they are mostly used in the rural areas. Yes, so like I explained, the use of charms, waistbands, traditional medicines, and incantations. Another type of contraceptives, we call them traditional methods. So people usually interchange the meanings of non-scientific methods and traditional methods. Yeah, I think it's because of the name traditional. That's why people think that if it's traditional, then they're non-scientific. Like I explained, say use of traditional medicine, charms, but traditional methods. Okay, these are natural family planning methods. Okay, natural family planning methods. So these include withdrawal method. So withdrawal method, this is when a man and a woman are having sex. Okay, when a man is about to reach the climax or ejaculate or come, as people say these days, he withdraws the penis from the vagina and ejaculates from outside, not inside a woman's vagina, to prevent the sperms from entering the vagina to fertilize an egg. Okay, so this is the withdrawal. So this is, people use it, but it's not 100% effective because it becomes difficult sometimes for a man to withdraw, more especially when he's about to reach an orgasm. Like a woman might hold on to him, or maybe he might fail to he might fail to withdraw because of the orgasm. So this is not 100% effective, but if you're consistent, you remind yourself to say, I have to withdraw when I'm about to ejaculate. It is also a contraceptive that can be a traditional method that can be used to prevent pregnancies. So another traditional method is abstinence. So this is when you completely stay away from sex. So you completely stay away from sex, like you abstain completely. You don't indulge in sex. Okay, so this method, it does not offer any protection from STIs or HIV, because one, it is unprotected, especially if you're using a withdrawal method. It is unprotected, excuse me, so which means you're at risk. You might not get pregnant, but you're at risk of contracting STIs or HIV and AIDS. Okay, yes. So we'll move on to the modern scientific methods. Yeah, so modern scientific methods, these are methods that have been proven to be effective if practiced correctly and consistently. Okay, so they are very, very effective if practiced correctly and consistently. Okay, so under modern scientific methods, we have hormonal contraceptives. So this is the method that works primarily by interfering with chemicals that stimulate ovulation. Okay, so these includes oral contraceptives, which we call pills. Okay, so pills that need to be taken on a daily basis. They need to be taken on a daily basis. So if you want to access these pills, you go to a health care facility. They will give you the pills and give you instructions on what to take, which one to take every day. So you take them on a daily basis. So they are combined contraceptive pill, which contains two hormones called estrogen and progesterone. Okay, so they stop the release of an egg ovulation, the pills. So that's their work. They stop the release of the egg or ovulation. Okay, so apart from the pills, we have injectables. So injections, when you go to the health facility where they give you the contraceptives, they'll inject you. So that injections last up to 3 months. So if you want to continue with your pregnancy prevention, you have to be going there every after 3 months. They inject you, it will be effective for only 3 months. Then you get another injection. It's either get another injection or they change your type of contraceptive, or maybe you try another one like implants, which lasts for more than 3 to 5 10 years. Okay, so we go to another modern scientific that is used these days, hormonal implants. Okay, so hormonal implants, they slowly release small amounts of hormones that stop ovaries from releasing an ovum. Okay, so another one is another method under modern scientific, barrier methods. So barrier methods, these are methods that prevent contraception by obstructing the man's sperm from getting into contact with the woman's egg. So they obstruct that contacts between a man's sperm and a woman's egg. So examples of of barrier methods are female or male condoms and diaphragm. So I'm sure by now everybody knows what condoms are. So we have female and male condoms. So how do you use these condoms? So a man will wear a condom correctly. So you should bear in mind that when you're wearing a condom, you should wear it correctly. If you don't wear it correctly, you risk it bursting. And never should you double condoms, wear 2 condoms at the same time. Okay, you just wear it once correctly. You make sure that the tip, I wish I had a condom nearby. I could have demonstrated to you how you can wear a condom. So at the tip of the condom, there's so a bit oval-shaped. So you hold the tip, you wear so that air doesn't enter into that tip to avoid bursting. So you should be like, you shouldn't wear it completely up to the end, up to that tip at the end there. So it should be left, that tip should remain like that, so that when you release your sperms, they are trapped in that tip at the end of the condom. Okay, and then we have another one. We have another barrier method, another example of barrier method called the diaphragm. So a diaphragm is a soft curved dome. It's a soft curved dome shaped latex or silicone device placed in the vagina. So it's curved like that. It's like a dome like that. So it's shaped like that, and then you insert it in the vagina to block the entrance to the cervix. So when you're having sex, instead of the sperms going in the cervix all the way to the uterus, the fallopian tube to fertilize the egg, so that's the diaphragm will prevent that entrance, because it will block your cervix. Okay, we also have spermicides. Okay, we also have spermicides. Spermicides, they are chemicals that kill sperms and prevent conception, which is pregnancy. So they kill sperms and prevent conception. So spermicides can be in form of a tablet. Okay, so they're inserted into the vagina shortly before intercourse. You insert, it's like a tablet. You insert it in the vagina, and then that tablet will kill the sperms and it will prevent conception. I will also have intrauterine device, IUDs. So what are these intrauterine devices? So we have two. We have two types. We have two types of intrauterine device. Okay, so we have the copper IUD, and we have a hormonal IUD. Okay, so the copper releases copper. It also acts as a spermicide, like I explained earlier. And then this copper, it's a small, the intrauterine device, it's a small flexible, it's T-shaped. You know how T-shaped is device. It is placed, so when you go to the health facility and you tell them that I want to put IUD, they'll get that T-shaped device, and insert it in the uterus, all the way in the uterus. Okay, so like I said, there are two types. There's copper iodine, which acts as a spermicide. Okay, it releases copper and acts as a spermicide, and this can last up to 10 years. You can have it in your uterus for like 10 years. You can, yeah. So it's 99% effective. So you can have it in uterus for 10 years. And then you have another one, a hormonal IUD, which contains progestin. It also prevents sperms from reaching and fertilizing the egg by thickening the cervical mucus. So every woman has got cervical mucus, okay? So when you put that with the hormonal IUD, it releases the progestin, and it prevents the sperms from reaching, blocks it, prevents the sperm from reaching and fertilizing the egg. How? By thickening the cervical mucus. Okay. And so that's it on the intrauterine device. So people, others, they also call it a loop. It's also known as a loop. Okay, so like I said, it prevents fertilization. It prevents fertilization from taking place. You can call it a loop. Here in Zambia, we call it copper T because it's T-shaped. Unfortunately, I don't have those contraceptives to demonstrate or to show you how they look like, but I'll later on post pictures of these contraceptives for better understanding. Okay, so apart from the modern scientific methods, we also have permanent methods. But before I continue with the permanent methods, allow me to explain the two types of pills. Sorry, I forgot to explain that when I was allow me to explain the two types of pills. So we have two types of pills. Remember, I first explained on oral contraceptive pills. Okay, so there are two types of pills. We have the combined oral contraceptive pill, and also have the emergency contraception. We have oral, combined, and we have emergency contraceptive, commonly known as morning after pill. So this is very common because it's like almost everybody who is indulging in sex, especially unprotected sex, they use the emergency pill or the morning after pill. So emergency pill, you take it within 72 hours after having unprotected sex. Okay, so 72 hours after unprotected sex. And then for the combined oral contraceptives, like I said, it contains estrogen and progestin that prevents the ovulation or stops the release of the egg. So this one, you take one pill per day. So it can be you take every day, each day one pill. And then for the emergency, you only take it when it's an emergency, when you've had unprotected sex, or maybe when you've experienced if you're on other contraceptives and then you vomit or you have diarrhea. Yes, that's when you can take your emergency pills if the other contraceptive pills are not being effective at the moment. And it can only be taken within 72 hours after having unprotected sex, or Some people can also take the emergency pill if you've let's say for instance you've been raped. Sorry to say that, to use that as an example, but if you've been raped and you're ovulating or something, you can take that, because it's not like you plan for it and you're not on any other contraceptive, and the person that maybe did that act didn't use condoms, so you can take that emergency pill. So note that emergency pill does not, all these contraceptives, they do not, apart from the condoms, they do not prevent you from getting HIV and AIDS and STI. They do not prevent you from contracting STIs. Okay, so now we go to permanent methods. So we have permanent methods contraceptives. So this can be used both by male and female. Okay, so for permanent, they're also called sterilization. Permanent methods, they're also called sterilization. So for men, you use vasectomy for men, in which each testicle is clamped or cut or sealed. So when your testicle is clamped or cut or sealed, this will prevent you from releasing sperms. It will prevent you from releasing sperm, from mixing sperms with the semen that is ejaculated from the penis. So because of that, an egg cannot be fertilized when there are no sperm, when there's no sperm in the semen. So vasectomy is when they cut, they clamp, or they seal the testicles. Okay, so this is a permanent. There's nothing, if you cut, like there's nothing you can do about it. If you've cut, it's a permanent method. It will prevent, it will not release sperm that will fertilize an egg released by a woman. Another permanent method is bilateral tubal. It's a bilateral tubal ligation in women where the fallopians are tied. So this is mostly advised for those people that already have children, and they don't want to have any more children. Like they're done with giving birth, they just want to focus on other things, they no longer want to get pregnant. So this is what, especially for if somebody has reached an old stage whereby they cannot have children anymore. So you are advised, that is a choice. You can have a choice to decide to say, I'm going to perform the bilateral tubal ligation, in which the fallopian tubes are tied, cut, or sealed. Yes, so this method works right away. So when it just cuts, no more having children. So if you're still a young woman like me, and you still want to have children, so don't go for the permanent methods. The bilateral tubal ligation is not advisable for somebody who still wants to have children, because your fallopian tubes will be cut or tied or sealed, and this will prevent you completely from conception. You will not conceive. Another one is non-surgical sterilization. So this is also for women. It involves getting a small device you put into each fallopian tube. So it involves getting a small device put into each fallopian tube. So when that is done, the scar tissues forms around the device to block the tubes. Okay, so when you put a device into each fallopian tubes, scar tissue forms around the device that has been put in your fallopian tubes to block the tubes, so your tubes will be blocked. So this method usually takes about 3 months for the tubes to be completely blocked. Okay, it takes about 3 months for the tubes to be completely blocked, for that tissue forms to form in your fallopian tube. Another one is jaw protection. So jaw protection, this is the use of condoms combined with other contraceptive methods, as none of the other methods can prevent HIV infection. Okay, so you combine other contraceptive methods with condoms. Let's say, for instance, you're on a contraceptive pill. Okay, you're on the contraceptive pill, and then you also use condom on top of that. So that's what you call a jaw protection. Okay, I forgot to mention, we also have an implant. So I forgot to mention the implant. So the implant is inserted under the woman's upper arm. So they'll put it here, they will insert it, so that one can last for about, it can be removed at any time. So when they insert the implant here, it just stay like that for years. It can stay like even for more than 4 years. Yes. So that one can be removed at any time. So what are the benefits of contraception? So there are many benefits of contraception. So in everything, there are always advantages and advantages. So what are the benefits of contraception? So it prevents you from unwanted pregnancy. It ensures optimum spacing between birth. So let's say, for instance, I get pregnant now and give birth. So instead of me, let's say, for instance, I'm married. Of course, after giving birth, I'll be required to have sex with my husband, and that means having unprotected sex, because in our tradition, well, you're not supposed to use protection, especially if both of you are HIV negative. So there's a higher chance of me getting pregnant when my baby is still breastfeeding. Okay, that doesn't, as long as you start doing you start doing your periods, there are higher chances of you getting pregnant. Again, even if your baby is 6 months, 4 months. So this gives you, when you use, if you're breastfeeding or you have a child, a baby, so if you want to have space, even if your baby is 1-2 years, if it depends with your choice. If you want your child's spacing to be 2 years, 3 years, 4 years, 5 years, it's up to you. So you can use the contraceptives, so it gives you space between birth. That's another benefit, and it improves the lives of women in general. You don't want to be pregnant, you're not ready financially or emotionally, yeah, so you use contraceptives. So you can also add on benefits, or if there are any other contraceptives that I've left out, in the comment box. Please comment, leave a comment, like, and share videos, because there are other people that do not know about these contraceptives. They only know the condom, they only know condoms, and maybe they do not even know how to use condoms correctly. So there are myths surrounding contraceptives. Some people say if you pee after having unprotected sex, then you'll not get pregnant. That is not true. Doesn't matter if you go and pee, then you'll not get pregnant. You are at higher risk of getting pregnant. So that's a myth. Also, some people say if after having unprotected sex, you go in the hot water bathtub, you sit in the hot water, then you won't get pregnant. That's a myth. So please comment down there, comment other benefits of using contraceptives and other types of contraceptives that you know of, or if you have any question, feel free to ask in the comment box. I'll be able to reply. Like and share. Thank you very much for listening. Have a good day. Bye.